Thank you so much, Dean Galea, and thank you to Provost Waters for having us. Just to pick up on a thread that Sandra just mentioned, there has been many decades of sort of a gap in federal support for research on gun violence, but BU has been a leader on this space. Dean Galea mentioned the ways that BUSPH has convened people on this issue. Dean Galea's own research has advanced this field. And here's the list of speakers today. And as he mentioned, when we look at that list, we see a lot of folks who are early in our careers and or new to BU. And so we have the opportunity to think about future directions for research at BU on gun violence. So in keeping with that theme, I'll be telling you about 3 projects from my lab at BUSPH, the RISE lab, and the junior folks who are leading those projects. By way of framing, another one of the most troubling statistics about gun violence is that gun injuries are the leading cause of death among children and teens. This trend preceded the pandemic, but got even worse in 2020 with the onset of the COVID pandemic. With colleagues, including Jessica Symes from sociology, we found that gun assaults against children during the pandemic doubled in 4 major cities, and white children, non-Hispanic white children's rates stayed steady, while children of color, especially Black children's risk, surged. So in trying to understand these trends, Suzanne McClone, she's a second-year Epi PhD student at BUSPH, has led a project using mortality data from the city of Chicago, where she came to us from the health department, looking at how neighborhood levels of COVID-19 mortality coincided with firearm homicides. And so she found here that the neighborhoods with the highest rates of COVID-19 mortality had the highest rates of gun homicide, and that trend preceded the pandemic. So it may not have changed here, but we can see how the same neighborhoods are experiencing losses from both of these issues, as well as opioid overdoses, not shown here, and that there are underlying social and structural drivers that put these neighborhoods at risk. In thinking about what those may be, this is a partnership with the city of Toledo, Ohio's mayor's office. Emma Gauze is a research scientist with the Center for Climate and Health at BUSPH. And we started working with them, and they said, well, you know, if you're interested in data, we sent people door to door to every address in Toledo. And we collected information about the built environment, like is the house, the windows broken, or is the door boarded up? Is there a tree on the property? Like, would you be interested in those data? We said, yes, we'd be really, really interested in those data. So Emma created this disinvestment score at the parcel level, and that's the exposure in what's called a case-controlled study. So we take every place that had a shooting in Toledo in the last few years, matched them with places that didn't have a shooting, but were otherwise similar on neighborhood poverty and land use and other built environment characteristics, and then compare what disinvestment looked like within a realistic 5-minute walking buffer of each location. And so Emma has found that increased physical disinvestment within that nearby area is associated with increases in gun violence incidents, even controlling for those important factors like poverty and built environment. And so the Mayor's Office of Neighborhood Safety in Toledo is now going to partners using this result to argue for more investment in neighborhoods. Last study, Alexa Cordopat, who just graduated from our MPH program, in partnership with the Boston Medical Center VIAP program. We'll be hearing today about a lot of excellent clinical services at Boston Medical Center. This is the VIAP program, which works with survivors of violence. Alexa picked up this thread, which there's been research on at BU for now several years. This question of whether people who survive gunshot injuries have the access to rehabilitation services they need. And what she and colleagues have found is that people who survive gunshot injuries are they're much more likely to be denied access to rehab once they're released from the hospital compared to, for example, this comparison group of people who survived motor vehicle crashes. This is a mixed method study. So Alexa and Megan and colleagues are going through clinical charts and as well as Alice, who just walked in, going through clinical charts and analyzing the language used. They found evidence of bias in the ways the clinicians talk about patients who've survived gunshot injuries. So we're analyzing this from the perspective of bias on the basis of injury and race. And so this isn't new information to folks who are working in this setting, but we hope that this research can help stimulate policy changes and practice changes in this area. Thank you very much.